Welcome to another episode of the BGC podcast. Today I am with Ashdin. And I'm sorry, how do you say your last
It's okay. Many questions. Billimoria.
name? Billimoor. There you
Yep.
go.
Sir.
I always ask, especially because of my accent.
Oh yeah.
And
yeah.
I always
Yeah.
mess around with
You're definitely not alone. A lot of people will botch it.
Yeah.
So I just tell them to call me like by my list,
Yeah.
which is fine.
So he's a managing partner at Strive2Move.
Yeah.
And tell us a little bit, what is Strive2Move?
Yeah, it's a great question. So Strive2Move. So we always say, typically most of the patients, I always like to say who we are, who we help, right? Most of the patients that come into our world have typically been somewhere before, whether it's like chiro, PT, ortho, massage, acupuncture, whatever, right? They've tried all those things and it's failed, meaning they haven't got a result that they were looking for. Whether that's a golfer trying to play 18 holes, whether that's a parent trying to get up and off the floor with their kids, or an adult just trying to go back into their gym community. They tried all those other things and they didn't have a good experience, or more importantly, they didn't get the outcome they were looking for. So Strive2Move is all about helping those individuals. First and foremost, you want to identify like what we call root cause, which we can go into, because it's more important to give people clarity around their problem. And we find we give clarity to patients on like what their actual problem is and why it's actually happening. You can see their confidence start to go up because now they begin to realize that, oh, maybe I can get help and maybe I can solve this problem.
So now, just to clarify, so are you guys, if I have to put you in a category,
Yeah.
it will be chiropractor, personal trainer, therapy. What exactly is, or is it like a little bit of everything?
I think it's a fine question. Medically, we are chiropractors. We are not the traditional chiropractors. Which have you been to a traditional chiro before?
Yeah.
Okay, so then you're
A lot.
a lot of guys. Okay. You're like I said, you like a lot of our patients.
Yeah.
And the experience was what? Like, you go for 5 minutes, you lay on the table, you get ice heat stim, get your back wrapped.
Mm-hmm.
Yeah. So we are the complete opposite of that.
Mm-hmm.
We, like I said, we focus on getting to the root cause. So we like to call ourselves the root cause docs. So like medically, yes, we are chiropractors, but we are not the traditional chiropractors. We are very, very different.
Okay. So now, who is your ideal client? Like, what is your typical client?
Yeah. I think it goes back to like what I was mentioning earlier. Like our ideal client is someone that has been somewhere before. And I'll kind of tell you like the umbrellas underneath that. But like the overarching like patients that we see have been somewhere before and they haven't gotten a result. They've been to like traditional PT, like, like JAG, Glenboro. They're frustrated because what they tell us, they're in a room full of 5 to 6 people. Kevin and you get the same sheet of exercises for back pain.
Mm-hmm.
But the problem is you guys are entirely separate people. You have entirely separate problems. And the problem is they're just treating the back and not actually treating the cause or why it's happening.
Yeah,
Right.
the other one. I mean, I have a lot of times where like my back hurts because of my hamstrings, or my back hurts because of my back, or some of my neck, something.
Yeah. And then it's like you go to the PT and it's like, okay, well, you got back pain. Here's your descriptive exercises for back pain, right? Mm-hmm. And so we see patients from those areas that come to us because they're frustrated that they haven't got a result. And then underneath that, they could be a golfer. They could be an active adult. They could be a parent trying to get just up and off the floor with their kids, right? So we say like, big theme, people have been somewhere before. Underneath that, golfers, active adults, runners, parents.
Yeah. Now, what's the story behind Strive2Move? Like, let's talk a little bit about that. Like, how did this come about?
Yeah, well, like Justin,
Mhm.
right? So Justin is essentially the founder of Strive2Move. He started this practice with the goal of, you're looking at the individual, right? You're seeing what that traditional medical model looks like regular chiro, regular PT, and it's just when you look at that model, you realize it's not helping people long term. It's only treating the symptoms, right? It's actually treating the cause. More importantly, it's not really empowering those patients either to take charge of their health, right? And so Justin started this practice in 2015, and then I came aboard in 2019 as an associate. I was sharing with you, like I moved from Florida to work for this company because I saw an ad. I didn't want to work for any traditional chiro. Like I just couldn't do it. I just in my soul, like to my core, I was like, I cannot see 40 to 50 patients a day. I wouldn't remember their names.
Mm-hmm.
I wouldn't remember anything about them. I can guarantee if I look at my schedule, I can tell you one personal thing about every single one of my patients because we spend time with them.
Mm-hmm.
So I saw Justin's ad and I was like, okay, this is something I'm looking for. I told my wife, I was like, found a job. We were in South Florida at the time. I was like, I found a job. I was like, this is different, but it's in New Jersey. And she's like, and I was sharing with you, my wife's from Long Island. So she's like, Jersey? Like, I could never live in Jersey. I was like, let's just give it a shot.
Yeah.
So I came up, I interviewed, and I was like, this is it. And so we moved. This is my fiance at the time. She's my wife now. We moved with our 2 dogs. Literally picked up 1 dog on the way. We had a dog, picked up another dog. We moved up here, and yeah, been here since 2019. And then Kaylee and myself became managing partners in the business in 2024.
Now, what is how does a typical week look for you here?
A typical week.
Yeah.
And regard like patient care, you mean?
Yeah.
I mean, I could probably, on average, I would probably see about like 8 to 10 patients a day. We spend an hour with every patient. New patients are about 45 minutes, and then follow-up appointments after that is an hour.
And so usually how, I think I went through this, but you have like an introductory.
Yeah, that's a good question. So first step is like a quick phone call with our patient care coordinator, because we want to just make sure that we can help first. We always tell people, we just want to make sure, we can absolutely help. And then the next step is what we call is an introductory session, which is a discovery visit, which is about 45-minute free consult. Because again, what I was sharing with you, like we want to give patients clarity on the root cause of their problem. That's like literally the first step. Like if you have back pain, you need to understand like, why is it even happening in the first place? The number one reason why back pain like lingers and stays around and becomes chronic is because people don't even understand why it's happening in the first place. So literally step one is just giving a patient fundamental understanding of like, your back pain is coming from somewhere else other than your back.
So what do you think is like the biggest misconception that people have when they come to see you?
About just like in general?
Yeah, in general, yeah. Because I mean,
Yeah.
it's like you said, I think a lot of people just when they think chiropractors is like, oh, crack it, like you're gonna crack my back.
Exactly. I would say like we adjust maybe like 10% of our patients. It's a tool. It's not the only tool. So I would say the biggest misconception is like, are you going to be like the traditional chiro down the street? Right? They just don't understand how we're different. Like people are skeptical, especially if they've been to many places and they've been let down. Like they're like, what makes you so different? Right? What makes you so different than the chiro and PT down the street? And I always tell people, it's like, we call it like essentially like a game of opposites, right? Like PT, traditional PT, it's like the model is like you go to the ortho, you have back pain, you get your script for back pain. It's like, okay. And then what happens if what happens if the problem is coming from the hip? Well, like medically, they can't do anything else because they have to follow the script. But if the problem is coming from somewhere else, or you're just treating the back, that's typically where people start to feel that short-term relief. And it's like, I leave feeling good, but then it comes right back. And they go back into the gym or they go back and play golf, and it's like, I still have pain. And they just go through that cycle over and over again. So people are super skeptical. I think the misconception is they don't know what makes us different. Yeah, especially with our process.
Yeah, because I remember the first time I came to see you a couple of years ago, like, I had the back pain, and then, we went through a few exercises, and you were like, okay, this hip is not moving as well as this one.
Yeah.
And I remember you having me and doing an exercise. I was like, oh my God, this is amazing.
Yeah.
Where I was coming here and I was like, oh, he's probably just going to crack me and adjust me and stuff, which I'm sure like I've been to a bunch of
for sure
chiropractor. I think I know every chiropractor around here, but some things work and some things don't.
Yeah. And like for the patients that it works for, like we don't see them, right? Like we always say, we're not for everyone, right? So the patients that actually are coming to see us, they didn't get the result. We don't see the people that they go to the chiro and they feel good and it's helping them. Like we don't see those people, and that's okay. But for a majority of people who are on this cycle of like pain and they just think that they have to live with it and that's just how it is, that's where the lack of clarity on why they're having a problem comes into play.
What do you think that, I think I read something where it's like 80% of people at some point deal with back pain.
Yeah.
And why do you think that it's so, I don't know if the right word is mistreated or, why is it so poorly treated?
It's a good question. I fundamentally 100% believe it's because no one is solving the root cause. And like when we go do workshops, like I always joke, like you're going to get sick of me saying that term, but it's such an important term because like you see a lot out there. It's like root cause, like a buzzword. Like what does it mean? And so like example, like I had a patient named Maria who was she's a golfer, has 2 kids, loves to play golf with her family, right? She came to me after years of going to like chiro, PT for her back because like it wasn't getting better. It would like get better for a short period of time. She would go for another season of golf and the back pain would just come back. And she was just super frustrated. And so the biggest thing that we are able to identify from a root cause standpoint is that she had an asymmetry from side to side in her hips, meaning she's a right-handed golfer and she's super stiff in her right hip. Well, it's going to be hard for her to take a full swing. So it's going to be hard for her to get and create any width in her backswing. And then if she has an asymmetry, meaning no range of motion here and a lot of range of motion here, it's going to be hard for her to control that range of motion in the downswing. She's going to compensate. But no one ever told her that her back pain was coming from her hip. And if you don't have good motion in your hips or good control, the back and the hips, the back's going to pay the price. And so I think the biggest reason why it's mistreated is because everyone's just treating the symptoms, not actually treating the cause.
Now, when you say hip, like it's just like the muscles around the hip, right?
This is a good question.
Yeah.
Yeah, great question. Yes and no, right? So when we look at the hips, we're looking at the joint. How well does a joint, when we look at range of motion, we're looking at how well does a joint move through its range of motion? Meaning, can a joint fundamentally move through the range of motion without your back compensating? So easy terms, let's just look at golf, for example. When you go into your backswing and you're a right-handed golfer, your hip needs to be able to what we call internal rotation, right? Or internal rotation. If it can't do that, well, your body is going to compensate. Our bodies are amazing compensation machines. And your body's going to compensate that your low back's going to chew up a lot of that range of motion. So we look at the muscles secondary, because if the joint doesn't have good range of motion, the muscles are just going to be tight. And that's actually where the next one, where people just think they need to stretch more, because if they feel a muscle that's super tight, their first inclination is I'm just going to stretch more. And then they keep stretching, but they still feel tight.
Yeah.
No, you probably shouldn't keep stretching, because it's not the answer. There's something else in your body or your movement patterns that's going on that's breaking down to cause that muscle tightness.
Yeah, because I went to there's a guy that I went to as well. Like I said, I've been to a bunch of them.
Mhm.
But that I guess when you stretch a muscle, you kind of make it softer.
Yeah.
So if you're stretching right before you go out and play,
Yeah.
It's better to actually kind of. I remember when Tiger Woods used to say, "Oh, I couldn't activate my glutes."
Yeah.
And he gave me a bunch of exercises. And it was like, you need to make sure that you activate your muscles so that they're fully there. They're
Sure.
okay, ready to go.
Yeah. I look at that, and I think that's a part of it, right? And then you have to figure out where in if you have let's say back pain, where in your rehab journey does that need to happen? And so before we look at activation, before we look at flexibility, we're looking at we call mobility. And our definition of there's a difference between mobility and flexibility. And a lot of golfers that come into our world, and not just golfers, but other patients, they don't understand the difference. Nor do they need to. No one's ever explained it to them. But you think of a golf swing in general, it's a lot of moving parts that you have to be able to control. They hit a tiny white ball. And any little thing that messes up, it's either gonna my biggest problem is I take a divot right behind the ball every time consistently. It's very frustrating. Ryan and I work out all the time. But if you look at that and you just okay, where in my swing is that breaking down? It's you want to look at the joints first. And joints can have either a lot of range of motion or no range of motion. We always joke do you need WD-40 or do you need duct tape? Right? Yeah. And so, but then that's also what the problem when you go to PT. It's you're just gonna get the same. Those two people are gonna get the same sheet of exercises.
Yeah.
But they need entirely separate programs.
Yeah, because I think that one thing that I see a lot is you have back pain, you go to your regular doctor, right? The regular doctor might say, okay, go ahead and get that MRI.
Yeah.
I feel like everyone has a herniated disc nowadays.
Yeah.
It's if you play golf, you are gonna have a herniated disc or something.
Yeah.
And then it's okay, you know what, go to PT.
Yeah.
And you do some little exercises, but then that just keeps us sick. Nothing happens.
Yeah. Yeah.
Or they go ahead and give you a shot, which helps you for a couple months.
Symptom relief, right?
Yeah.
Yeah. It's our patient Mike. So this is Mike worked with Kaylee for a few months. Mm-hmm. Mike's biggest frustration is that he has 2 kids. He likes to golf, but what you just said, injections off PT, numerous rounds of PT, disc herniation. He's in his 50s. And his biggest concern is okay, I'm 50 and this is what my back pain feels like now. What is 65 going to feel like when I actually want to retire and play more golf? Right. And so for him, it's his biggest thing was why does this keep happening in the first place? And so you can actually fundamentally put him through an assessment. So you said, disc herniations, we call it mechanical low back pain, right? Disc herniations, arthritis, stenosis is the big 3 that we'll hear when patients come into our office. Okay, but there's a reason why those are happening in the first place. And we always say mechanical low back pain needs a movement solution. But in order to get a movement solution, you need to understand like root cause. But if you don't understand root cause, you're not going to solve the problem. You won't solve the problem long term. You'll just be on that endless like hamster wheel of trying to solve it over and over again and just getting frustrated.
Now, besides the hips, what other parts are usually the culprits for back pain?
Yeah, like you want to talk like for golf or just back pain in general?
I mean, general, but let's talk about golf.
Perfect. Okay. So when we look at like golfers specifically, we're looking at like hip range of motion. So like good range of motion, bad range of motion. Yes or no? That's like two areas that we want to look at, right? Next, we're going to look at like, I always think this is so funny because every time I'm going to explain this to a golfer, I can see their eyes be like, what the fuck?
Yeah, of course.
Like, what the fuck are you doing right now? It's like, because, and I say, just hold on, like bear with me for a second, right? Because when we talk about the rib cage and the ability of the rib cage to move, that has a big effect on back pain. So like a thing that we always talk about in our office is like above and below from a root cause standpoint. We look above the area or below the area. More often than not, it's typically the hips. But if the hips aren't the problem, we're going to look at above the low back, which is your rib cage. And if the rib cage is super stiff, your low back's going to take a lot of that stress and strain over and over again. And one of the questions you asked me earlier about like how back pain happens, it's not one thing. It's like, because you'll hear it a lot, oh, I bent over and I threw my back out. Maybe that's just probably the last straw that broke the camel's back. But typically with back pain, you'll see it's a series of like issues that are built over time that just compound interest over and over and over again. And then poof, that's when you start to get the pain.
Now, on the other side, how long does it take to fully get rid of back pain? And how does that look?
$1 million question, right? Like how long does it take? It honestly, what I tell patients when they come in the office, it depends. I can't confidently tell someone how long it's going to take to fix their back pain without putting them through an assessment. But also more importantly, seeing how they respond to care. And so you asked about our process. It's like we have that first step where you come in for that free consult where we begin to understand and give you clarity on the root cause. Well, then we have another session after that, which is one session where you get to come in and we get to see how you respond to care. Based on how you respond to care allows us to make a better recommendation for like how long that's going to take. On average, though, to give you an idea, on average, anywhere from 15 to 18 sessions. I know it was interesting. Last week, Kaylee had a golfer named Kevin. Kevin's about to retire. Like he works hard, he's literally about to retire, but his biggest fear is like, how am I going to play golf when my back consistently hurts? Like I've worked hard for the last 30 years and now I'm about to finally retire. And I can't even go play 9 holes with my son, right? And so, but Kevin's biggest fear was very skeptical because he's done everything under the sun. Is this going to take years? And we were almost like, oh my God, no. Like, we just need to figure out root cause first. And once we figure out root cause, on average, anywhere from 15 to 18 sessions to get you back to playing golf long term, right? And again, like we'll never guarantee that. Sometimes it has taken longer, but for majority of our patients, that's typically the time frame.
Now, how does this, the sessions, what can you describe a typical session?
Sure. Like just a typical session on a treatment. Yeah. I think anyone that comes in is on a treatment plan. Their treatment plans are going to look like if we were both patients at Strive, our treatment plans would look entirely different. I have some patients that we call like manual therapy that gives them like soft tissue work to like just loosen up the muscles. And they get exercises. More so, we say exercises, but they're actually like custom movements to solve the problem, right? It's not like you go on YouTube and like you see these like open work exercises, right? Or like banded glute bridges. Like we're actually teaching these patients how to move better and then actually like integrating it back into their goals. That's where I think a lot of rehab fails. It's like you just get these exercises like banded clamshells or glute bridges, right? And like fine, like okay, that should be like day 1. But if you're doing that at like day 8 of your rehab plan, you got a problem because your body's not going to respond anymore. And so typically what the sessions look like eventually is like we're integrating the movements back into your goal. So a line that we always use is like your rehab needs to look like your goals. So if I have a golfer that it wants to gain distance off the tee, right, at some point in their rehab plan or one of their sessions, there is going to be a drill that is working on distance, right? Like we're working on like the fundamental swing of movement to gain distance off the tee.
So now the good thing that you mentioned that. So I play a ton of golf. I already have.
Lucky you.
Yeah, well, I actually do. Yeah, it's a good thing. But let's say I
have young kids. So
yeah.
good for you.
I play a ton of golf, which I'm sure my wife is not happy about that. but I want to gain more distance. I don't have back pain.
Yeah.
I do have back pain, but I'm saying
Sure.
if I didn't have back pain, I'm a let's call that performance golfer.
Sure. Yeah,
Yeah.
I think that's a good segue. So the question would be like, what is a performance golfer?
Yeah, exactly. Yeah.
Yeah. So like to that point, we have two types of golfers. I was telling you earlier, two types of golfers that we see in our office. We have golfers that are struggling with back pain, hip pain, knee pain, right? And they can't get through a round of golf without their back flaring up. They can't get through a round of golf without taking Tylenol, right? Or they can play up to 9 holes and then on the back 9, their back goes into spasm, right?
Mhm.
And so those that we call them those like our pain golfers, right? Well, we also have a population of golfers that we treat and call performance golfers, where they don't have any pain. But here's the thing with those: they're competitive, right? They want to gain distance off the tee. They want, like every golfer, more consistency. I would say the two biggest things of performance golfers. But there's also a social aspect to these performance golfers, where like they can still play, nothing's stopping them from playing, but they're stiff.
Yeah.
They're stiff, but they can still play, right? That's like an example would be like my patient Jim.
Mhm.
Jim has no pain, but I've been working with Jim for 6 months now because we've been working on gaining distance off the tee. That was his biggest thing. But Jim is also very similar to Kevin, who is going to retire in the next 5 years. But like, he knows that the older you get, the stiffer you get.
Mhm.
So he has like a window of opportunity to work on his overall body now before it gets worse. And so from a performance golfer standpoint, they're super stiff. They want distance. They want more consistency, but they also want to stay competitive with their buddies.
Yeah.
Like it was interesting actually. Like my patient Paul, it was actually it was like kind of sad, but like I understood why he was coming to see me, because Paul had no pain. It was like 0 pain, but he was very, very stiff. But as golfers, you guys we go on a lot of golf trips, right, with your buddies.
Mhm.
He was not as good as his buddies, and so the reason why he wanted to work on his overall mobility, per se, is because he wanted to be invited on the trips. So while yes, it's about distance, it's also there's a social aspect to it, that they want to continue to play with their friends. They want to stay competitive. Maybe they're competitive at their club, right? And so from a performance golfer standpoint, they have to fall into those like categories, you would say.
Now on the other side, I do know that you work with some I think I use this word a lot, but elite golfers.
Okay,
Because everyone said more elite than me.
Yeah, fair.
But yeah, but very good golfers. Yeah, but I always use elite because I like the way it sounds. But so like I've seen you work with like college kids and with with PGA Pro.
Sure, yeah.
How does that differ from a person that's okay? You know what? It's somebody on the older side who's looking to deal with the pain, as opposed to like somebody who's actually competitive and does this or has aspirations to be a PGA Pro or a tour player at some point.
Yeah, I think that's a great question, actually. That's a really good question. So almost, if I'm understanding correctly, it's almost like, how does their treatment look different? Or like, what does that look like for
Well,
them,
yeah.
right?
How does the treatment look different? How does that relationship, with is it more like, okay, I just see you once in a while,
Oh.
or like, hey, we are actually working towards getting you better?
Great question. No, not if we're like working towards a goal, whether you're like an elite golfer versus like my dad that wants to play every weekend in the summertime, like I always say there's a window of opportunity that we have to fix stuff, because truly, if I see a patient like once in a while, we're really not going to make any like changes to their movements. It just won't happen. Like I always say, like changing function takes time. Like it takes time, right? And there's a series of movements and progressions that you need weekly so that your body can start to adapt, right?
Mhm.
And so like, I just think like YouTube, right? Like those golfers should go on YouTube and they would type in like golf mobility, golf stability exercises. Same with my dad golfers. The fundamental problem with like YouTube is that while yes, it has all the information in the world, there's zero implementation, meaning like you could find a really good exercise, but then are you doing it correctly? Like, are you feeling in the correct places? Or are you doing enough reps? And the big question I always have, is it even the right exercise for you at this time? Meaning like, this could be an exercise that you're doing at the beginning, but you really should be doing it at the end of your treatment. And it gets too hard. Like your body's not making any changes. And so with those golfers that you're asking about, it's like, no, I'm going to see them weekly, because there's phases in our treatments that we have to meet. And there's objective changes from a range of motion standpoint, a control standpoint, that objectively, like, we need to measure over the course of a treatment. And so I don't necessarily know if the treatment would look different from like a golfer in their 70 versus a golfer in their 30, right? We're still working towards objective goals and we want to be objective about it. But also my conversations would be different with them as well from an expectation standpoint.
Yeah, and I know everyone's different, but if you just had to say that if there's one part of our body that we need to fix in order to hit the ball further,
Hips.
hips.
Hips. Yeah. Hips.
It's on the
I mean,
hips.
it's all hips. But Shakira, hips don't lie, right?
Yeah.
And so like the hips are just it's the first thing that happens in the sequence of a golf swing. Like the hips need to be able to rotate for you to get your club back. And then it's also the next thing going as you transition to the downswing. And so if you have good range of motion or you have bad range of motion, like whether that means you need to do more mobility exercises or more like stability exercises, like we have to figure out which ones, but the hips would be the root of the issues, that the number one thing people need to work on.
Just to be able to go ahead.
Yeah.
Yeah, because I mean, especially for me, I notice how when I'm not feeling good, I just tend to move my right hip completely, like put on my body completely just to be able to move, to get to the swing.
Yeah. So like an example would be like, well, we'll talk about like, so one of my patients, one of our patients, Jane. So Jane's biggest issue is like she was on the side of like having good range of motion, but again, her biggest issue is that every time she would hit the ball, she would get like outer hip issues, like pain here, right? And so the reason why that was happening is because like when she's in the swing here and she has good range of motion, so backswing looks fine, she wasn't able to like transfer her weight down. And then from down, she wouldn't be able to like turn like this. Instead, it would just be like this, and her hips would push towards the ball, right? She would early extend, right? And so while she didn't have any pain other than like the hip tightness here, it was really interesting. Like her son's a professional golfer. Golfing is like literally in her family. And I will remember this line, like she wants to golf into her 90s, which I think is amazing. Like she has the capability to do it, but we have to work on her body to do it. And so when I was using for like the hips, it's like, I always just think like, we have to understand, like, do you need range of motion or do you need like more duct tape, more control? No, that's also the problem with YouTube. It won't tell you the difference.
Yeah, it won't tell you the difference. Yeah. The only thing I come across of that is, people feel like people are too quick to say, oh, I feel sciatica, I feel my nerve. And what I realized, at least for me, it was never the nerve. It's just basically the muscle, and that's just like, obviously a part of it might be like something with the nerve, but a lot of times it's simply the muscle around it. So, what's your advice to people? Because I feel it's so easy for people to go ahead and say, hey, get an injection. Go ahead and there's a surgery. It's like everyone's like pushing you nowadays for no reason. What's your advice on that? What are your thoughts on that? And what are you, what happens when somebody actually has that? Like, okay, this is an actual nerve, something that's really bad.
Yeah, anytime. So it's interesting because you'll see a lot of people that will complain of like hamstring tightness, like one side more than other. Like, oh, if I like my right hamstring always feels tight. That can that can be sciatica. So because the sciatica nerve like travels down the back of the leg, right? And it's in between the hamstrings, it gets masses like hamstring tightness a lot. And then what happens is people just constantly like stretch, but they're actually making it worse. So my first advice would be like, if you have sciatica, that's not normal. You shouldn't be, no one should feel nerve pain down the leg. We see a lot of people that will come in here and be like, yeah, I've just been living with it for like years. I'm like, that's not normal. Like you shouldn't be, every time you play golf, you shouldn't feel like sciatica pain down the back of your leg. Like that's not normal. We have to figure out why that's happening, because it will get worse. Like you have to do something about it. Like back pain will get worse over time if you don't do anything about it. Because a lot of times we'll hear people say like, oh, I'll just rest. And while, resting might alleviate the pain, as soon as you go back and play, it's going to come right back. I guarantee it. So rest is never an option. And so my advice for people with sciatica is that first step is to figure out root cause. You need to understand like why it's happening in the first place. And then we need to figure out how to actually solve it.
Okay.
Yeah.
So with that in mind,
injections will not solve a problem.
Injections
will not solve a problem. They could work. Sometimes the injections don't even work. That's the crazy part. We have a lot of patients that tell us they get injections and it doesn't even work. Like the pain just comes right back, or they didn't feel anything.
I've taken 2.
Yeah.
And I think I came to see you after the second one, but it felt amazing for me the first couple of weeks.
Yeah.
And then 3 weeks later, I was the same thing.
Yeah. And look, sometimes if you need like if you're like, I understand, like if you're like in a lot of pain, right? And you just need some sort of relief, like you just need some sort of like relief. I'm okay with it. It's just the expectation around where like I'm going to disagree with people. Like if you need like a relief like quickly because you just can't tolerate the pain, then okay, I'm okay with you getting the injection. But just understand, as long as we're on the same page, that it's not solving the problem, and we can have a conversation how to actually fix this long term, and you not depend on just getting injections every 2 months. Okay, then we can have that conversation. But if sometimes if people just need some sort of relief because they can't even like get out of bed, it's like, I understand that.
Yeah. Now, with that in mind, what I would like to do is kind of like show a little bit of the exercises or some stuff.
Sure.
Yeah. Okay, so we're gonna go ahead and show a little bit of like, so for those who are listening, this is the part that you probably want to go ahead and go online or on your phone and see. But Ashley is gonna show me some exercises. Gonna look into like some of the things that the typical, a little bit, of course, of what he does. Yeah, a sneak peek of what he does. Yeah.
Yeah. All right. So whenever a patient comes into our office, we want to take them through a detailed movement assessment because that goes into along with our core premise of finding the root cause, right? And so I know a little bit about Danny's history, like chronic back pain. I'm going to show you guys a little bit more about what an assessment would look like, and then we go through some like an exercise or two just so you can start to see a little bit of a difference.
Cool. Perfect.
Right?
Yeah.
So just lay on your back for me first. Face up.
Face up.
Yeah. And so, like, as we were talking about, specifically with the golfers, we're going to pay attention to the hips first, because one of the biggest root causes that we see with back pain is either there is a asymmetry from side to side with the hips, meaning one side moves more and one side moves less, or there's just a lot of stiffness in the hips. But we need to understand why that's happening for Danny's back pain. And so you're righty, you said, right?
Yeah.
Okay. So the first thing we're going to do is we're going to look at your hip range of motion. Okay. And so right now, just holding your hip up, just relax your hands for me. Do you feel any like tightness or tension in the back?
Just a little bit, yeah.
A little bit? Okay, so like step one, like that's not normal. Like if he's moving his hip like this, he shouldn't feel anything into his back. So now you can imagine like if you just feel your back on the table, like what's going to happen in your golf swing with a lot more speed, right?
Yeah.
Okay, and so the first thing we're going to look at is hip rotation. So bring your foot like this. Good, hold that there. I want you to rotate your hip out towards me like that. Okay, good. Pause. What do you feel there when you do that? Any back discomfort?
No, but just right here, that's kind of like the tightness here.
Okay, tightness in the front of the head. Okay, so if I do that, do you feel like a pinching pain?
No, not yet.
Okay, so this is also, do you mind if I make a point here?
No, yeah.
So this is a common thing that people will just like look past. And it's not their fault because they don't know. But anytime when we rotate our hip and you feel the front of your hip here, that's not normal. Because now long-term, we're starting to think, are you going to develop a hip problem? Are you going to start to develop some sort of degeneration in your hip? Or are you going to have some sort of like pinchy pain in the hip? That means you are chewing up your hip motion. And most people, what they'll do, Danny, is like they'll just have a tight hip flexor and they'll stretch it. But the problem is that that's not the problem at all. And so now let's look at your hip motion. Okay, so we're going to rotate here. So that was you, right?
Mm-hmm.
Okay. Do you feel anything in your back right now?
No.
Okay, so now do you feel how far that you can take your hip? Like, good. Now, do you see how much farther do you feel how much farther I can take you?
Yeah.
So this is where like most people would think like because they feel tight in their hips, they would need to stretch, right? The problem is like he wouldn't need to stretch at all because stretching won't solve this problem. He doesn't have a flexibility problem. He has a mobility problem where now we need to teach him how to actually control the range of motion he needs to have in his hips so he doesn't chew up his low back. Does that make sense?
Yeah, makes sense.
Do you mind if I look at the other hip?
Yeah.
I just actually want to see like an asymmetry. The biggest thing you'll see a lot of like with like our performance golfers is they'll think they need either like more lessons, new clubs, right?
Yeah, new clubs is it's a common one.
It's a common thing, right? Or they just need to work on their speed, right?
Yeah.
And so they'll cycle through all that and they're so frustrated because they're not gaining distance off the tee, right? And so like I always think about this from like if you can't just fundamentally get into the positions that you need to, and you can't control the positions that you need to, no clubs, no stretching, none of that, no speed training is going to fix the problem because your body needs to be able to actually access these positions to just create enough speed so that you can get more distance off the tee. But we'll see a lot of golfers like, oh, I just need a new club. It's like, do you really need a new club? You actually just need to work on your butt.
Yeah.
You probably need to work on your butt. Okay. Would you say, do you feel like you have more rotation in this hip or less? Less.
Yeah.
Yeah, I would agree with that. And so fundamentally, we're seeing like an asymmetry from side to side with your hips. And so we can sit you up. And so what we see with that is like no motion here, right? But if I take you farther, means you can access it, right? So we know you have good range of motion. So you need like more duct tape here. This side, you need more WD-40. We just need, I just give you some motion, right? Give you some motion so that your hips can actually like shift and clear. Because I know what you said to me, right? Like your hips push towards the ball, correct?
Yeah, whenever I have pain, I basically end up early standing. It's just, and you know, I played with pain for like a whole year and a half, and my swing just completely messed up because this was me.
Yeah.
Taking the hips there. Now, you know, just to come here, it just.
Do that one more time for me. Like that. And then you see how like, because he lacks motion here, his low back kind of arches like this, and then your hips push towards the ball. So that's where we'll typically see the early extension. But the reason why you get the right side of low back pain is because you're overextending through your low back as opposed to letting the hips come through. But again, if we don't have good motion in our hips, you see how easy it is for your body to compensate and chew up your low back. And so the first thing we need to work on is actually, yes, giving you better hip range of motion, but we actually need to work also on your core so that we give you a better base. And so I can show you some drills now. Okay, so do me a favor. You're going to lay on your back. Okay, knees, hips at 90 degrees, feet on the wall.
Okay.
And so this is another difference about like...
So like...
Yeah, so your back would be on your back. Hips bent at 90 degrees, feet on the wall. So scoot closer. So I feel like this is always the hardest part of the exercise. Okay, good. So this is also another, when you ask us the difference, right? One of the key differences that we do here versus like traditional PT is that I'm actually with Danny the whole time. We are one-to-one. Like I am not off in the corner with my other patients. I don't even have any other patients. It's literally one-to-one. You're not doing stuff on your own or with an aid. Because again, like I want to teach you these movements. We want to teach you these movements. We want you to get a good understanding of how to actually do them so that long-term you can learn how to do stuff on your own, right? We have to get you there, right? You can't learn that if you're doing stuff in the corner with a PT aid or just on your own with a group of 5 to 6 people. So like it's one-to-one, just like this is how a normal session would go. So feet up. Yep. Good. Okay. So the first thing we're going to do is start to take some tension out of your low back. Okay. So I want you to put arms up to the ceiling for me. Yep. Turn the palms here. And first things first, I just want you to take a deep breath like there's a candle on the roof of the ceiling. You're going to do a long jaw and exhale for me. Well, one more. Beautiful. You see how you feel how like your ribs start to drop. So what that's doing, you can relax your hands. What that's doing, that's starting to put your core into a better position. Because first step is like, we want your rib cage and your pelvis to be in a neutral position. That in order to fix your hips, we have to get your rib cage and your pelvis into a more neutral position.
Yeah.
Okay. Does that make sense so far?
Yeah, totally.
Because a lot of times you'll get like that pain. Typically it's like that pain right across the back here or one-sided, right? And so if our pelvis is always like in this arched position, we need to get you out of it, right? And so the first exercise we would do, so put your arms up now. Yep. And this is where I say, stay with me for a little bit. Exhale your breath for me. Beautiful. Okay, now all I want you to do is take some deep breaths in through your nose and push out into my thumbs here. Good, exhale. Good, and try to think about expanding into my fingers here. 2 more. Beautiful. Good. 1 more. Good, relax. So that would be like one exercise we would do to start to get the core into a better position, okay? Now, I'm gonna show you one for the hip.
Yeah.
Big no beer. Now we want to start giving your hip some motion, right? So you're gonna put this in between your legs here. Okay, good. Give it just a little bit of squeeze, not a lot. Arms up to the ceiling again. Okay, good. Okay, again, exhale your breath for me. So just blow all your air out. Okay, now keep this foot on the wall, this knee touching the foam roller. Keep this knee touching the foam roller. Let me just take your foot off the wall. Yep, and now like a windshield wiper, start to rotate this hip out. Okay, good. Pause. Just breathe for me. Good. And then rotate back in. You should start to feel like your outer hip, like here engaged. You shouldn't feel your low back engaged. Okay. So just do one more rep. So the first thing we want to do is we call like activate. We want to start to just teach your body how to move without compensating. Right. And so this range of motion that you're doing here is the first range of motion that happens in the golf swing.
Mm,
When you're standing, internal rotation,
yeah.
this is what's happening. And so we want to start, good, relax. We want to start, you can wash your hands. We want to start with like the basics, start to build a foundation. And so one of the things you asked earlier is like how we're different, right? Well, we have like we call it like one of our programs, our treatment plans. We have 3 phases of care. Within those phases, there are progressions through each. And so you start at the bottom to build a foundation, but you can see how this rotating your hip is the same thing as you doing
Yeah.
this. The same mechanism, this happening is this happening.
Yeah.
But you can't do it standing yet because your body compensates. So we need to teach you proper foundation
In order to.
in order to build it back up.
Perfect. Well, man, this is really fun.
Yeah, this was
Really
great.
good.
Thanks for having me.
I really appreciate it. Yeah.
Yeah. I think if people, the listeners who are listening out there, if you want to learn a little bit more about what we do, I would say you could follow our Instagram, which is just the handle Strive2Move, and you can give us a follow. We post a lot of helpful content. And if you need help, you can send us a DM.
Perfect. Thanks a lot,
Thanks,
man.
man.
I appreciate it.